My name is Wendy Young. I'm an occupational therapist and certified hand therapist, and I'm really looking forward to the Surgery and Therapy Summit, where I'll be sharing my research. I've been blessed by God to have had over 20 years of experience rehabilitating people with hand injuries, mostly in Durban, South Africa. Together with colleagues, we have published 2 papers in the Journal of Hand Therapy. Both papers are similar in that they are individual case studies, and both individuals are young men who sustained the same injury, a complete traumatic amputation of their hand at the level of the distal forearm with replantation. The surgery was done by Professor Mahendra Daya, and both patients received intensive occupational therapy. The first man sustained a machine injury at work, and this case report, which details the therapeutic intervention and excellent functional outcome, was published in 2020. The second man sustained his injury violently, and he agreed to be interviewed and recorded throughout his rehabilitation. This culminated in my master's and a qualitative paper in a narrative style. This was published in January this year. My hope is that after this presentation, you will leave with some new practical therapeutic tools. You'll see the value of carefully listening to the stories of your patients and be more aware of the effect of violence on both you and your patient and ways of dealing with this. Bongani lives in Africa. He is a young, healthy man who works diligently to support his family. While at work one day, intruders enter. His colleagues are forcefully bound with cable ties. Bongani is ordered to kneel down and place his hands on the table. He obeys reluctantly, but his thoughts are terrifying. His reality is a world where people live in fear of witchcraft and the potency of muti, or magical medicine made with human body parts. Are these intruders there to steal his hands? A heavy blow, and his hand is hanging by a thread of flesh. The intruder is shocked as he cannot see the hand on the floor. He hesitates and then flees with his empty bag. Laying in a pool of blood, prays to God, and Bongani survives. Bongani has surgery to reattach his hand, and he receives 2 years of occupational therapy. Despite the memories, fears, and danger, he regains his identity, his humanity, and hope for the future.